Hello, everyone. I'm Gary Baumgarten, and I expect that you know that. And I want to thank you for joining us for this discussion on Facebook, on paltalk.com, and on YouTube. And today we're talking with a very important guest, in my estimation, Dr. Hagai Levine with Hebrew University in Israel, who's the premier expert on epidemiology in Israel. Dr. Levine, thanks for joining us.
Thank you, Gary.
Thank you, and there'll probably be a little bit of a lag there, and I'm sure everybody recognizes that and won't be too upset by it. Dr. Levine, I want to start out by asking you, what's the situation on the ground in Israel today?
So we have seen a stabilization of the number of new cases and new deaths and new severe cases. So after a pretty long period of lockdown, even almost with some period of complete lockdown and very aggressive measures that were taken to slow down the spread of the epidemic, and it was pretty successful. And now we are heavily discussing what is called the exit strategy, and there are all kinds of changes in the policy. It's very hard to understand what is the policy, what is the rationale of the policy. For example, today, the barber shops were open and people could go to the barber. But on Tuesday, there is a complete lockdown, and even people that lost their close family members in the wars in Israel are not allowed during the Memorial Day to go to the cemetery, which is like almost holy in Israel. So it's not clear what is the rationale and what is the plan, what are the objectives, and what are the facts. And I will gladly elaborate on that.
So I'm guessing that the situation there is similar to the situation here, in that we have politicians pulling in one direction because they want to get the economy going, and the medical community pulling in the other direction because they want to make sure that this, when we tamp it down, it stays down and doesn't rear its ugly head again. And I want to talk about the how this actually works, because I think a lot of people don't understand, because they talk about individual choices. It's my individual choice. If I want to put myself at risk, I will put myself at risk. But Dr. Levine, aren't they putting you and I at risk as well?
So this is public health. And it's fascinating that, you know, it's really a concept that it's difficult to understand about prevention and about the responsibility to other people, about solidarity. So what happens, and we know now a lot about the SARS-CoV-2, the new coronavirus. We know that the main mode of transmission is through droplet and in close contact. So if we are in less than 2 meters from each other and we speak or sneeze, we can infect each other. Now, what we know now, that there are probably more asymptomatic carriers than symptomatic carriers. So you can definitely be infected without knowing it. So everyone should be careful at all times not to expose others and not to be exposed. And that's what we need, what we prefer not to call social distancing, but physical distancing, because we should work together as a society and you know, stay close to each other, but not physically. We should keep our hygiene very much. And you know, now there is a change in the policy regarding masks. Now in Israel, you are obliged to wear masks in public places, and masks have some role in preventing, especially just to be aware that you can be infected and infect others. We should protect the most vulnerable, those with chronic diseases such as diabetes or chronic heart disease or lung disease, and those above the age of 60, they are at much higher risk of dying from COVID-19, and we should really protect them. My mother and father and grandmother lives right 200 meters away from my home in Rehovot in Israel, and I have not seen them from close contact, only from the balcony for a very long time now, and we continue, even though now maybe it's allowed not, but we continue to keep this distance in order to protect them. So we need the right balance. On the other hand, what you said about the politicians and the professionals, actually in Israel, it's very different from the United States. It's very interesting. Here, there is some politicians that go, to the extreme, that we should not open anything and just to keep closed so we prevent transmission, while there are some health professionals who say, hey, like myself, who say, hey, we should keep the right balance because we should learn how to live with the virus. We cannot keep this complete lockdown for months because, people die from other diseases because they don't get medical treatment, because they are lonely. So we must keep the right balance. And currently in Israel, for example, unlike New York, I have many friends in New York, you are not allowed to walk more than 100 meters from your house unless you have something specific, essential. You are not allowed for sport. You are not allowed to go more than 500 meters. You are not allowed to go to national parks, open space where you do not meet anyone. You are not close. You cannot transmit. So, and they give a fine to someone at the sea that went to the sea to surf at the sea, and a boat came and he was alone and came to give him a fine. So, we need to have what my father is calling common sense is not so common. We need common sense. We need to keep what we have to keep, which is to protect the vulnerable, and somehow.
Okay, we're getting a little lag. We're getting a little
kindergartens, and actually.
Yeah, we're getting a little lag on you right now, Dr. Levine. We're gonna try to push forward and hope that the internet rectifies itself. I know the viewers and listeners are aware.
No. So maybe I will listen.
Boy, your internet connection just went really bad. So while we're waiting for that to either self-rectify or for you to rectify it, I'm going to ask you the next question in the hopes that this works. And that is, there's a lot of talk about herd mentality because we don't have a vaccine, in the hopes that if a majority of us, and I don't know what the number exactly is, it's 70-something%, if I understand correctly, have contracted the coronavirus, even if we're asymptomatic and didn't know it, then there will be a natural immunity among all of us. Is that really something that we can possibly look forward to here?
Not yet at all. Not in New York, not in New Jersey, not in Israel. We are very far away from what is called the herd immunity. We are not even close, not to any scientific principle. So we have to understand that even in places like in Israel, where we were able to maintain the transmission low, at any time we should keep alert, and very easily, if people are not alert, if people are not keeping the orders, if they are having parties, etc., we could go very fast back to a widespread transmission, which we could not stop once it's there again. So no, the herd immunity, if the disease is pretty contagious, the virus is pretty contagious, so you need much more than 50% of the population to develop immunity. And actually, the World Health Organization warned yesterday that we don't know for sure what kind of immunity you have after you got infected. So even though science tells us that you get some protection, it's not necessarily complete protection. So we should try to live as much as possible, but we should be alert. That's the balance that is needed. Not to say this is influenza. This is not influenza. But not to say this is the only important thing in life, because this is not the only important thing in life. So we need to keep the balance. Actually, with my colleagues, Professor Gershon, Professor Didi Gershon, Professor Alexander Lipton from Chicago and from the Hebrew University, and myself, we took the actual data from Israel and other countries, and we modeled according to a very sophisticated mathematical model. My colleagues, Gershon and Lipton, are really world expert on that. And we have seen, and we have a simulator. We can say, okay, what we do, if we do that, what happened? We look. So if we look from now in Israel, what will happen? And we now model New York, by the way, we don't have the results yet. What will happen in Israel? We see that there is going to be a second wave, which is larger than the current wave in a few months from now. If we see what in Israel, what did we need the lockdown? So it depends what is your target. If our target was to have less people on respirators than what we have in Israel, even without the lockdown, but with other extreme measures, we were not supposed to get over it. But it does not mean that it was not justified or that we don't need to be alert, because there are, many people die in such event. So I'm just saying, in Israel and in the United States and in other countries, we should monitor all the time. We need a lot of testing, and we need the right testing, and we need to test at the right place. We need to support as much as possible the health system, including the public health system, who is in the front line, not only in the hospitals, but also in the epidemiological investigation. And each one of us has to have personal responsibility to try to avoid contact as much as possible. If you have fever or cough, you have to isolate yourself and not to go outside. And this is a difficult situation. I hope that every crisis is an opportunity. I hope that we will come out of this challenging event to know that health is so important, and to invest more in public health in Israel, in the States, and everywhere. That's what we preach for, public health professionals, all the time. I hope that people will not forget, once we get over it, this important lesson.
Dr. Hagai Levine at the Hebrew University. One of the things you mentioned, by the way, your internet connection is great. Keep it that way. But one of the things that you mentioned was what the World Health Organization said. I think it's true from my understanding of it, my reporting suggests that we don't know when people have been declared free of the coronavirus, of the COVID-19, and released from the hospital, and then they come down with the illness again, and we don't know, if I'm correct, whether they are reinfected or whether it was a false negative that that the testing showed.
We have to rely on science. There is no other way. And we see now a great scientific endeavor. People that are not in health sector come from other fields, and to help the health professionals and the health scientists. It's amazing. It's great. We should collaborate, and we should test everything, with the chloroquine. Is it a good drug? I don't know. We should test. And then once we test, we should do trials, and then we know. Maybe it's good for specific situation and not for other. What is the usefulness of masks? It makes sense, but there is also downside. So we should test. It's true for every policy, for every drug, for every prevention measure, and then we can correct. And I must tell all my fellow scientists and decision makers, you have to be careful. At each point, you have to keep the public trust and tell what you know, what you don't know, what you're going to close this gap between what you know and what you don't know, and go on the safe side. But as we do in medicine, sometimes at time of uncertainty, you have to make decisions. You cannot always go to the safer side. Sometimes you need to make tough decisions because there is also a balance. So it's really difficult, but we have to based on science and not on fears. And in some countries, we see that the fears determine the decision making, and that's a problem.
Yeah, we don't want to be overly frightened by it, but on the other hand, we don't want to be cavalier. And as you said it initially, we have to strike a balance here where we can continue to move our society forward, the economy, but not to the point where if we rush back into it, that suddenly it spikes. And we saw that in Hong Kong and other places. They went back a little too soon. They had great, tough measures initially. And they were able to flatten the curve, which is a term I never heard of before, but I'm hearing it every day now. They flattened the curve, and then they went back to work, and they said, whoa, 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 we got to throw you guys back into isolation, everybody. Go back into your houses. And they did it quickly enough, and maybe their government infrastructure is such that they're able to, or maybe because it's a more homogenous society than we have in the United States, people adhere to the dictate a little bit easier than we did. But what scares me is as you try to strike the balance, I'll use Jacksonville, Florida as an example. They said, okay, we're going to open up the beaches, but we don't want you sunbathing. You can walk across the sand. You can go in the water. You can surf, but we don't want people congregating on the beaches. Okay, that seems like a prudent first step toward normalcy in an environment where they rely on tourism in order to maintain their economy. And what happened? A significant number of people jammed on the beach. And what are the cops going to do? You're going to arrest everybody? The police in New York don't even want to approach anybody anymore because they're afraid of getting it. So yes, the scientists have a responsibility. We in the media have a responsibility, but individuals have a responsibility to think about, use what God gave us between the ears a little bit and not do stupid things like that.
Well, Gary, you damn if you do, and you damn if you don't. It's really complicated, and we need to monitor not only the spread of the virus, the spread of the disease, and keep an eye on the most vulnerable, the people that need intensive care unit, but we also should keep an eye on public behavior, and this is true. And we should also notice that we cannot really know what people are doing at their home. Maybe people come to visit their friend and then they infect them. So it's not only about the public places. I believe, and that's how I was taught in public health, and that's what my experience and the scientific experience tell us. It's not everywhere the same, but that you have to keep the public trust. We did an international survey in more than 20 countries, and we have preliminary results with Israel, but it started from Montreal. According to the survey, we asked people, and I'm not saying it's the best way, but we asked people, what is the most important determinant for you to decide if you keep the recommendations, the physical distancing, etc., or not? And you know what? The most important things were about information that is relevant for me. If I know that I am risking myself, my family member, if I understand how the virus transmits, then I follow. If I am only getting fines and I'm not getting the logic, if I only get threats and I'm not understanding the logic, that's less important. Of course, you need the carrots and sticks. You need them both. I'm not saying we need the police, but we need the right balance. Again, at the same side, I know, and just to say, it seems like in some states, in the United States, there is not the right balance, and they don't understand that you cannot stop once there is a wide transmission. It's too late. So I understand, and I share your fear of this, and what we see. We see what is going on in New York and in other places. On the other hand, we see in Israel, in some countries, the catastrophic impact of a very long lockdown. I know about people that elderly that stay at home alone for a long time. Now there is the right balance. There is no magic bullet, but we can minimize. We can find the ways to allow lonely people, for example, to keep contact with them, to allow them to go for a walk and to some countries, they close the street for cars, and now there is a wider space to walk in the street. And people need to understand, again, you are not there in the street to speak with your friends and infect them. You are there because you need also to go outside a little bit. In Israel, by the way, there are great advancements in working from away, in learning from away. I'm teaching at the Hebrew University, my students, and the studies continues, and we are doing that from far. There are disadvantages, but there are some advantages. We learn to do better teaching like that, and I'm sure it will serve us when we go back to normal time. So again, I'm really trying to be optimistic, to be realistic, to find what we can grow from this experience. And yes, you are right. Every one of us should really be alert and try to avoid as much as possible to infect others, no matter what are the guidelines. We just need to understand and change our habits. I use, to hug and kiss and shake hands. We cannot do it right now for a very long time, by the way. It's not going to go away very soon. Of course, we can hope that with the summer, there will be improvement, maybe, but there is no evidence for such thing at the moment, and we have to, and we may have a worse time in the winter, so we have to check, to be alert, and to use science and to help each other. That's also very important, because you may have a neighbor that cannot go or is a danger. Maybe you can bring in the groceries, so that's something we need to work together as a society. And I see amazing volunteering in Israel, and I see amazing, startup nation, amazing new inventions on how to better tackle this very complicated situation. So I believe in the human spirit. Even this virus could not overcome us.
So my final question, I know you're very busy, and I appreciate you taking the time, Dr. Hagai Levine at the Hebrew University in Israel. Please tell me, can you look into your medical crystal ball and tell us, will we have a vaccine? What's your best guess?
I feel that because we focus on the vaccine, we don't do enough what we need to do now in preparation and in public health measures, etc. And not understand. We should not rely on a vaccine. This is unpredictable because we need a safe and effective vaccine. I believe that we will have a safe and effective vaccine, but it will take time. We have to do it scientifically. And even after we have a safe and effective vaccine, we will have to manufacture it in mass production and then to deliver it. It's really complicated. So together with investing in research and development, and my fellow great scientists, some of them are right here, very close by, the Weizmann Institute of Science and other places, should do their work. But on the same time, we have to focus on what we need to do right now and not to have this kind of thinking, okay, there will be vaccine in the future. No, we should do what we need now. We should find the right balance between living with the virus. That's the key thing. And not only vaccine, by the way, we also have drugs, and we should see, and we have some development, we should see what drugs are effective against coronavirus. I am also afraid that when there is a vaccine, people will not use it, because of the people that give rumors, anti-vaxxers. And I should also remind you, that it was published 2 days ago that in Israel, the routine vaccination program got down by 30% during this time. Now we say we should continue with vaccines. Otherwise, and it's all over the world, otherwise we will have outbreaks of measles and other things. So we should also, we don't have vaccine for corona, but we have vaccines for other things. So everyone, don't stop your routine vaccination schedule. Children should be vaccinated. And again, I must say the good news, by the way, the good news, it seems that the virus is really, children are very low risk for complications, and they do not transmit as much as influenza. They do not transmit the virus to older people. So we should see maybe we can be more flexible with children. We should check that now. And again, we know much more about the virus right now. It's difficult, I must say. It's difficult. It's a marathon. It's a marathon. It's not a sprint.
I'm taking that word of advice and I'm taking that snippet and I'm sending it to my daughter in the hopes that she will let me hug my granddaughter because it's killing me like it's killing you. You can't see your mom and dad. I can't hug my granddaughter. It's just unnatural. So
Right.
let's hope we do strike that balance. Dr. Hagai Levine at the Hebrew University, thanks for joining us on Facebook, on Pal Talk, and on YouTube. It'll get posted on all three once we shut off this recording. Unfortunately, we couldn't do a live on Facebook, but we were able to get a live to Pal Talk thanks to the good works of Irene Rada and Alan. Thank them both for their assistance. And I'm going to do another interview with you when we have a cure to all of this, so we can have a celebration.
Thank you, Gary. Thank you, Gary, and hope to visit you in, in the States.
You're back in New York in Mount Sinai. Let me know. We'll get together by then. Hopefully, we can actually see each other face to face and then elbow. We need some exercise. We got better.
Right. Very important.
Okay.
Thank you, Gary.
Thank you.
Bye-bye.
Bye-bye.